Good morning, I'm Dr. Vermusni. Today I'm going to transfer the patient from bed to chair and chair to bed. So the first thing I will do, I will check the doctor's order and check the patient's chart for immobility and prepare all the equipment and bring it to the bedside table of the patient. So here are the materials I need in transferring the patient from bed to chair and chair to bed. I need chair, and I also have here with me towel. And in performing hand hygiene, I have here with me alcohol and gloves. So next I'm going to perform hand hygiene. And next, I'm going to identify the patient, explain the procedure to the patient, and provide privacy. Good morning, sir. I'm Dr. Vermusni, your student nurse. Can I check your wristband? Can you state your name, sir? And your date of birth?
2004, January 15.
So, sir, I'm going to transfer you from bed to chair because the purpose of that is to promote blood flow, reduce you from having bed sores, and promote comfort. And next, I am going to close the curtains for privacy. And I am going to remove the top linen of the patient. And this will go to the hamper. And before I move the patient, I will check for the machines that is with the patient, like IV lines and call bell. So after, I will assist the patient in position for moving the patient to from bed to chair. So sir, I'm going to flex your knee. Can you put your hands here? And in a count of 3, sir, I will move you to your side. 1, 2, 3. So after that, I am going to help or assist the patient in sitting. So sir, in a count of 3, I will help you in sitting po, no? So 1, 2, 3. So now that the patient is already sitting, I will ask the patient, sir, are you alright? Do you feel any pain? Are you dizzy?
Yes.
So if the patient said yes, allow for time to recover, or so that the patient won't feel dizzy. And in transferring the patient for transferring the patient from bed to chair, I will now put towel around the waist of the patient and secure it. So make sure not too tight and not too loose. Now that the towel is already secured around the waist of my patient, I am now going to put my legs in between my patient's legs so that when he stands and get out of balance, I can support the patient and we won't go out of balance together. Now, I will ask the patient to hold on my shoulder. Now, sir, when I count 1, in a count of 3, we will stand together nice and slow. 1, 2, 3. Now that the patient is already standing, I will assist the patient in going to the center of the chair. 1, 2, 3. Before sitting the patient, I have to make sure that the patient is in the center of the chair. And now that the patient is already in the center of the chair, sir, we are now going to sit together, nice and slow, on the count of 3. 1, 2, 3. Now that the patient is already sitting, I will remove the towel around the waist of my patient. And next, I am going to remove my gloves and perform hand hygiene and document the data. And now I'm going to transfer the patient from chair to bed. Same procedure, I'm going to perform hand hygiene. And next, I'm going to identify the patient, explain the procedure to the patient, and close curtains for privacy. So, good morning, sir. I'm Caliber Musnir, student nurse for today. May I check your wristband? Can you state your name, sir? And your date of birth? So, sir, the purpose of transferring you from chair to bed is for you to rest and be comfortable. And now I'm going to close curtains for privacy. And next, I will use the towel and wrap around the waist of my patient. And make sure that the towel is not too tight and not too loose. And now I'm going to put my legs in between my patient's leg and ask the patient to hold onto my shoulders. Now, sir, in a count of 3, we will stand together nice and slow. 1, 2, 3. Now, I will assist the patient in going to the center of the bed. 1, 2, 3. And before making the patient sit, I will make sure that the patient is the center of the bed. And sir, in a count of 3, we will sit down together. Nice and slow. 1, 2, 3. And ask the patient, sir, did you feel, how is it? Do you feel dizzy?
No.
And after asking if the patient is okay, remove the towel around the waist of the patient and assist the patient in laying flat on the bed. So, sir, I'm now going to assist you in laying flat on the bed. 1, 2, 3. Okay. Now that the patient is already lying flat on the bed, I will assist the patient in putting his legs on the bed. So, sir, in a count of 3, I will assist you in putting your legs on the bed. 1, 2, 3. Okay. Before putting the top linen, I will make sure that the machines that is with the patient, like IV lines and call bell, is with the patient. I will now put the top linen on the patient. Sir, can you hold this? Yes, sir. Okay. Go back, sir, please. Sir, do you feel comfortable?
Yes.
So, after doing the procedure, I'm going to remove my gloves, perform hand hygiene, and document and report.